My name is Alexi Del Vecchio, and I'm a first-year emergency medicine resident at Mayo Clinic in Rochester, Minnesota. I am thrilled and grateful for the opportunity to present at SAEM 21 this year. The name of my presentation is Results from a Theater-Based Communication Course for Emergency Medicine Residents in the COVID Era. This research is supported in part by a research grant from the Society for Academic Emergency Medicine. By way of background, I worked as a professional actor before med school, acting in film, theater, and voiceovers. I became interested early on in my medical training to find a way to utilize my performing arts background to improve healthcare delivery. I created an acting-based course to develop and improve the communication and interpersonal skills of healthcare professionals, and this course has since been taught at multiple medical and nursing schools and residency programs in the United States and Canada. According to Albert Mehrabian, a social scientist and scholar at UCLA who devoted his professional life's work to the study of communication, 93% of communication may in fact be nonverbal. 7% is made up of the words we choose to share content. 38% of our meaning is transmitted through our voice and tone, and 55% is contextualized through our body language choices. Therefore, acting, with its focus on both verbal and nonverbal communication, may provide a unique approach to develop the communication skills of healthcare professionals. Our course is made up of two one-hour-long sessions. The first session focuses on skills of body language and status, the second on verbal communication, active listening, and emotional intelligence. We also provide clinical correlates after each exercise, giving examples of how participants can apply the skills developed in their clinical practice. All learning objectives are cross-linked with ACGME and AAMC core competencies for residents and med students. We end the workshops with a standardized patient vignette in which participants play the role of a patient and healthcare provider and are tasked with applying the communication skills developed. The theme of each SP vignette is related to the skills developed during the training. For instance, for our nonverbal communication workshop, the vignette relates to interacting with a so-called difficult patient, and for the verbal communication one, the vignette is about breaking bad news to a patient. After each workshop, we also distribute a communication toolbox to participants, listing and describing some of the skills developed during the training. We previously taught the course pre-COVID, but for this study, we wanted to assess if participants still felt they developed valuable skills, despite the use of masks and social distancing made necessary by the COVID pandemic. We distributed post-workshop surveys to participants, asking them to rate on a Likert scale their self-perception of skills developed over the preceding hour. These results are from a one-hour session conducted last July as part of orientation activities for first-year emergency medicine interns at the Prisma Health Upstate residency program in Greenville, South Carolina. For this session, all participants agreed or strongly agreed that the workshop developed their skills of self-awareness, observation, nonverbal communication, situational awareness, sensitivity to emotions expressed by others, breaking bad news, communication with so-called difficult patients, teamwork, presence in the moment, and mindfulness, and all enjoyed the experience. These results are encouraging to us and suggest that participants feel they developed clinically important communication skills despite the use of masks and social distancing. Through piloting this offering, we've also learned that it is possible to train non-active faculty to facilitate the course for their learners. Nursing faculty at the Clemson School of Nursing in Clemson, South Carolina, have been trained as facilitators, and the course will be part of the clinical skills nursing training for their students, although implementation has been delayed due to the COVID pandemic. Because of COVID, again, we've had to learn to become adaptable and have since converted the course for new learning modalities. I collaborated with a colleague at the Cummings School of Medicine in Calgary, Canada, and we adapted and taught the workshops to 150 pre-clerkship medical students via Zoom last January. In terms of next steps, we've distributed 6-month post-workshop surveys asking participants to report if they've applied these skills in their clinical practice. Here at Mayo, we've designed surveys for patients in the ED to assess their perception of their provider's communication and interpersonal skills. We also will be distributing match questionnaires to emergency providers in the emergency department, asking them to assess their self-perception of communication ability, and will compare patient and physician responses before and after providers undergo this acting-based training. And as another next step, we plan to further develop and validate our survey instruments, which will be the subject of a future research project. I so much appreciate your attention, and I look forward to discussing live with you all in just a few moments.